Hello, my name is John Nguyen, Communications Specialist for the OC Pich program. My role for this program for the past 3 years has been to share health messages with the residents of Garden Grove, Santa Ana, and Anaheim. And today I'd like to invite you to learn more about our program. I've invited a very special guest with us today, Dolores Barrett, the principal investigator for the program. Hi, Dolores.
Hi, John.
How are you doing today?
Good.
What is the OC Pich grant?
Well, Pich is the Partnerships to Improve Community Health. It's part of a national agenda from CDC, which is the Center for Disease Prevention and Disease Control. It's a nationwide project to prevent chronic disease. There are 91 projects throughout the United States.
What is OC Pich then?
OC Pich is our Orange County version of Partnerships to Improve Community Health.
Help us understand the need for this grant.
Chronic disease takes up about 80% of the medical community's time, of its resources, its money, and about 80% of chronic disease is preventable. And in communities of color and low-income communities, the percentage of chronic disease is much higher than other communities. So in order to make an impact on that chronic disease, we need to go upstream. We need to figure out ways to prevent it rather than to provide medical services. Let's stop it from ever happening. Let's help those communities that have fewer medical services, that have fewer resources individually, stop going to the doctor by preventing them from becoming ill.
Why is KPOC a good fit for the OC Pich program?
The truth is we're an anti-poverty agency. In fact, we're the official anti-poverty agency in Orange County. So to take the lead on anything that impacts low-income communities would be appropriate for us. And we're great partners. We work with lots of other groups, always have. We've always felt our role wasn't necessarily to be the direct service provider so much as the person that builds capacity and partnership.
What made Anaheim, Garden Grove, and Santa Ana ideal target communities for the OC Pich program?
They're the largest 3 cities in Orange County. The grant was designed for small cities and large cities, and of course large cities would get a lot more resources. So we met that threshold. By putting the 3 cities together, we had over 800,000 and the threshold was 500,000. But beyond that, in suburban environments, so much of everything that happens with policy or policy systems and environmental change happens city to city to city. We thought if we could get 3 cities together, could we build some momentum? Could we see how cities feed off each other, how cities support each other? Could we, instead of just working with one city and getting some success here, could we work with 3 major cities, look at strategies that worked in all 3 cities, looked at interventions that one city did that another city then replicated, and really move the whole agenda much quicker.
Who are the partners in this collaborative?
We have 10. SSG, which is Special Service for Groups, and UCI, which is the University of California for Irvine. Those are our evaluators. We wanted to make sure that the work that we were doing for the community was effective. Then we had groups that would work on policy and change, and those were AHOC, the Alliance for Healthy Orange County, OCFAC, which is the Orange County Food Access Coalition. Then we had another large institution, the Orange County Department of Ed, which would work with all the 3 school districts. And then the 3 cities, Anaheim, Garden Grove, and Santa Ana, had contracts with us. And then we had the nonprofit community, which was Kid Healthy and the YMCA of Anaheim.
There are always challenges when working with a collaborative or partnership of this magnitude. What were some that you faced?
Well, first of all, you have 10 partners. So to get everybody on the same page is always a challenge. But I think the biggest challenge for us is because we're a nonprofit community and not a municipality. It was to get municipalities both to work together and to work with the nonprofit community. We wanted to make it as easy as we could, so we allowed them to choose the projects, the infrastructure changes that they wanted in their communities that focused on health. But we also wanted to get them to understand that they were part of a larger group and a collaborative that was working on changing health for Central Orange County.
Tell me about the successes of OC Pich.
We have a lot. Each of the cities did some infrastructure changes. So we have at least 3 parks that now have physical activity equipment in them. In the city of Santa Ana, we have bike lanes and we have benches and bike racks. So we can measure by just looking at things, how things have changed. Also at the schools, we have the Fit Kids Centers, which means that every school that had an empty classroom, we converted into a place like a little small gym that had all sorts of activities for the kids so they could participate in in physical activity. But we also have some policy change, things that you can't see. In the city of Anaheim, we have a master bike plan, which means that they're planning ways for the city to increase their trails and make safe ways to bike. In the city of Garden Grove, we're about to pass a master pedestrian and bike plan. In the city of Santa Ana, we have the Vision Zero. Vision Zero is a policy that says the city's going to make changes to make sure that no more pedestrian or bicyclists get hurt in the future.
Are there plans to sustain the work after the funding has ended?
We always had plans. From the very beginning, we thought, what happens in 3 years? 3 years sounds like a lot of time. Actually, when you're building park equipment or bike lanes, it runs out pretty quickly. We always knew that what we wanted was to start momentum. One of the things that happened was that the two cities followed Santa Ana's lead, and they've both now applied for active transportation funding, and they both received it. So we know that the work is going to keep going for active transportation, and active transportation is any kind of transportation, walking, biking, rolling, that you're not sitting in a car. We want people to get out of cars and moving. We also have some of the things that were instituted by OCDE and Kid Healthy that will continue long after the grant has run out.
And do you feel like OC Pitch could serve as a model for other collaboratives?
We're looking at what happens after OC Pitch is gone. As I said, we started from the beginning thinking what happens next. And I think the county started it pretty much at the same time we did with the health improvement plan, and they've got collaboratives that are focusing what groups can do together to move the agenda forward to prevent chronic disease, how they can impact low-income communities. That work's already occurring. Orange County's always been really good about collaborating. The city's not as much as the nonprofits. That's what we do. We have limited resources, so we figure out who has something we don't and work together.
Well, I think that we have a good understanding now of what Pitch is all about. So thank you so much for your time, Dolores.
Thank you.
And if you would like to learn more about OC Pitch, visit our website and like us on Facebook. And thank you so much for watching.